everyone. Welcome to this week's Stanford Live edition. We are so excited to have our nursing float pool staff here with us today. We've only had one other nursing unit do one of these before, so this is huge for us. We're super excited. Nancy and Jason from Nursing Float Pool are here to talk more about their unit, talk more about float pool, as well as talk about career opportunities that they have there on their unit for nursing. So any questions that you have, feel free to pop them into the chat. They will be answering those for you today. I'm just really excited to get started. So I was going to start off by introducing Nancy. She is the patient care manager over Nursing Float Pool, and she can tell you a little bit more about herself.
Hello, everyone. Thank you for joining us. My name is Nancy Carrier. I am the patient care manager of the float pool here at Stanford. I have been at Stanford for 9 years, all 9 years in the float pool. I started off as a bedside nurse, which I truly enjoyed. During my role at that time, I was also in shared leadership and did so many other committees. I then proceeded to become an assistant patient care manager for 2 years. And then I proceeded to become the patient care manager of the float pool. So float pool is very near and dear to me. I am excited to share with you more about the float pool, and we look forward to bringing more talents here at Stanford. Stanford is a level 1 trauma center. It's a magnet hospital renowned in Northern California. And I'd also like to give a chance to Jason to introduce himself as well. Jason?
Yes. Thank you, Nancy and Carly. My name is Jason Lee. I'm one of the assistant patient care managers here for the float pool. I've been at Stanford for 6 years, about 3 years at the bedside as a float pool RN. And then I transitioned to the assistant patient care manager role for one of the medicine units. And then I came back to float pool as a manager within the last couple of years. I started as a new grad on the float pool. And I love my time here at Stanford. It's a great institution, and I feel very privileged to be at such a wonderful organization with a lot of support and a lot of resources. So happy to share more about it during our session together.
And Jennifer Delgadillo, I'm going to throw it out to you. She is our talent acquisition recruiter that oversees all of our nursing float pool opportunities. If you just want to share a little bit more about you real quick and why you love working here at Stanford.
Hi, everyone. I'm so excited to be here today. So I've been with Stanford for almost a year. I recruit for all of our AAU units, but I am a recruiter for float pool. Have been working with the team for, again, almost a year. And I am excited to see what questions you guys have regarding our recruitment process. Hopefully we can get some answers or some questions answered for you today. And yeah, looking forward to our live today.
Well, Nancy, being the patient care manager, I'm going to kind of start this out with you. So a lot of people see float pool and they're like, okay, what is float pool? What units is float pool? Does that mean I'm floating to 10 different units a day, that I'm only with the same 2 my entire time at Stanford? So can you kind of dive in what your unit is?
Certainly. You asked a great question, because I did have the same questions when I was a new graduate nurse. I do recall in my search for a new grad program, I came across a lot of float pool positions. So float pool here at Stanford is a team of nurses who are adequately prepared to care for all the patients in all the different units. In float pool, we do have 2 teams of nurses. We have nurses that float to critical care units, so we call them critical care float pool. We also do have a team of nurses that float to what we call acuity adaptable units. This is a model at Stanford where nurses are prepared to care for both med-surg and tele patients. So every given unit is a specialty. And so if you're, for instance, in the orthopedic unit, you can care for a patient. If they're upgraded to telemetry, you would care for them. And then if they're downgraded to med-surg, you would just remove them off telemetry monitoring. So that's the model here we have at Stanford. So our float pool nurses in acuity adaptable units go to up to 33 different units. And then the critical care float pool nurses go to up to 6 different ICU units.
Well, thank you for kind of breaking that down. I know our AAU encompasses so many units here at the hospital. With these particular positions, what type of openings do you have within float pool? Nancy, is it full-time, part-time, per diem, night shift, day shift? Kind of what's the structure for your unit?
So we do have, right currently, we do have a lot of night shift positions. We also periodically have openings for day shift positions. All our positions open up as full time, which is point 0.9. Here at Stanford, we do 12-hour shifts. So you would be working 3 12-hour shifts. Uh, Part-time positions are reserved for permanent internal staff. So once you become permanent, once you gain seniority, then you can apply for a permanent position. So again, we have critical care ICU positions, both days and nights. We do have AAU positions, mostly nights, and every now and then we do have day shift positions that have been opening up.
Thank you so much, Nancy. And Jason, I feel like I'm kind of not letting you shine just yet. And I see a couple of different things popping in here as well. So a lot of talk about per diem. Do you guys ever see per diem on your unit, or is it mostly those full-time openings?
Yeah, that's a great question. We currently do not have per diem positions available yet. That being said, there is a lot of flexibility within the float pool because, we don't necessarily have a home unit per se. So we have a little bit more flexibility in the way that we schedule our nurses as far as them being able to kind of, have their schedules in the way that they would prefer. And I want to preface that by saying that it's more of a preference. We do scheduling by preferences, and then we kind of balance based on seniority, skill mix, and with respect to the organizational needs. I will say that one of the questions we get asked a lot is how do we sort of manage the day-to-day interactions with our staff, being that we don't have a home unit. And as a management team, we have 8 managers in total. We do frequent rounds and check-ins on our staff just to make sure things are going well on the units. And then as well as that, we have our unit educators available to help round on our staff and check-in as well.
Awesome. Thank you so much for that. Nancy, I'm going to kind of shift back over to you. So with float pool, I'm seeing a couple questions popping up here that kind of encompass. So is there specialized training for float pool? Is there a specific background you're looking for in terms of these candidates? And kind of what's the career growth for nurses within your department?
That's a great question. So we do take new grads as part of the new grad training program here at Stanford. We are actually getting ready to take 2 new grads. So anyone that has graduated from the nursing program that applies through our Stanford new grad program could be routed to us. We also do take permanent staff who are transferring from other organizations. One of the things that we look for is, again, we are at acuity adaptable model, so you would need to be tele-prepared. So we encourage people to make sure that they are tele-prepared, they can interpret rhythm strips. We also do have a very robust onboarding program that caters, that is customized to every individual. So for instance, if you have telemetry experience and you're coming down from a step-down unit, we do an assessment to kind of evaluate and see where your areas of opportunity are, and that's where we really make sure that we hone in on your orientation and onboarding. We make sure that you are comfortable to go to all these 33 different units, these acuity adaptable units. So we will pair you with a float pool nurse. We make sure that you go to all the different specialties and are well versed. After that, you do have shifts on your own where you're still working collaboratively with your preceptor. We have a mentorship program throughout where we make sure that we're pairing you with also previous new grads or new hires that can provide additional materials or insight on what to expect. And then, of course, once you go through the onboarding program that we've curated for you, if you still need more time, depending on how, on your assessment, we can give you additional time. We have had sometimes people who feel comfortable based on previous experience and onboarding that they feel that they are ready to be on their own, then we would let you be on your own. There is also didactic classes where you attend and learn different systems just to make sure that you're very comfortable. So these are so many different ways. Like I said, we have 2 educators and 1 professional nurse professional development specialist that will be rounding on you throughout to make sure that you're feeling comfortable and doing one-on-one check-ins with your preceptor and making sure that along the way that any questions that you have or any challenges that come along the way, we make sure that we support you in that sense. In terms of professional development, we have seen lots of growth within the float pool. We actually have 66 certified nurses at this point, which means they either have a PCCN and so many other certifications just to kind of improve and promote their learning. And then within the organization, we have the PNDP program, which is a program whereby you get promoted through your all the different things that you do in the organization. You kind of are able to go on the next step. So when you're hired as a new grad, you're clinical nurse 1. If you have previous experience, you're hired as a clinical nurse 2. And then within the department, we make sure that we support you so you can either become a clinical nurse 3 or 4 in terms of being promoted within the organization.
Thank you for that, Nancy. I think that was really helpful. Now I'll switch over to Jason again so you can get some camera time. So looking at some of these questions that are coming in, with float pool, are you covering PTO and vacations for these other units? Is that kind of what you're assigned to do? Or is this just something to where they're always going to have float pool nurses on the schedule? And that's just, it's what each unit expects for each shift?
Yeah, that's a great question. So the float pool, it has sort of different things that we kind of help cover as far as providing support for the organization. We do cover sick calls, and if there are certain units that have staff that are on a leave of absence, or that they may anticipate that they just need staff, we may pre-assign some of our nurses. But generally what our nurses do is they would, after they completed orientation, they would call our staffing office and at least 2 hours before the shift and ask where they're assigned. As Nancy had mentioned, the orientation is quite thorough and robust. And although we may not have the opportunity to orient you to all 30 different plus AAU type units, we try to orient you to sister or like units so that you still have the experience with the patient population. And then once you get off orientation, you feel comfortable floating to those units. One of the cool, I guess, unique features of our float pool is that not only do we help provide support in the way of staffing for our inpatient units, we've also been tasked recently with opening up these pop-up alternative care units. So if we needed a unit to help with some of the emergency department admits or some of the patients coming out of PACU, float pool recently has been able to kind of help open up an area of the hospital and kind of help alleviate some of the decompression from some of these units. And so that has been one of the nice things that our staff have found a lot of satisfaction in. And it's given them opportunities, like Nancy has mentioned, to be charge and to be float nurse and to have that experience as well. One of the other cool features of float pool too is that because we are kind of not a home unit, you kind of get to see things from a systems-based perspective. In the past, we've helped roll out technology for the hospital. We helped roll out one of the new automated medication dispensing systems when we rolled it out, and we switched over that product, rolling out new technology, doing sort of road shows. And I think that's probably one of the really innovative things about our team is that we're kind of like a conduit of information in that we go to all these different units. We're able to kind of see best practices across the house, and then we're kind of able to help disseminate that information throughout our float pool travels. We actually have a motto that our logo is a float pool duck. We actually wear a pin. All of our float pool nurses wear a pin on it with a ducky, and it says float pool. But our unofficial motto is we keep the house afloat, because we're able to go out and provide support throughout the organization as needed.
That's really cool. And I like the duh. It makes you guys fun and unique. Kind of, I guess, going off of that, Jason, I'm going to kind of, boomerang back to you again. What kind of team atmosphere do you guys have? Do you guys do different team building events, different things on the unit? Obviously you don't have a home base. You're kind of floating all over, so you might not interact with some of your, teammates as much. But how do you guys kind of keep that cohesive unit feel that other units that have a home base have?
Yes. I think first, as a management team, we always reiterate and emphasize to our staff about having an open door policy. We love it when our staff contact us either via email, drop by our offices, or even just, have a chat with us during our rounds. We love to foster those authentic and transparent conversations of what's working well, what are some opportunities, and just being able to foster sort of that safe space to share feedback and not even just talk about work itself, but also just kind of doing like a wellness check-in and see how things are going. I think that's been a big priority for our team and our organization. In addition to us as a management team, we also have opportunities for our nursing staff. We have shared leadership, which is a group of frontline leaders that meet every month to kind of make sure that voices of the nursing staff are heard, collectively, and it's not sort of a top-down approach, but that everybody's included at the table. We also have a sunshine committee, and that's just to kind of help facilitate programming in the way of like, mentorship for new nurses and having more experienced staff be able to step into that program. We have social events outside of work. It was a little bit challenging during the pandemic, and it still is given the COVID restrictions, but we've been creative in the way that we've been able to kind of still foster connections outside of work and making sure that it's safe and conducive to having that camaraderie with staff. So yeah, we do have programming outside. We have like our staff retreats, our summer socials, and things like that.
Awesome. Thank you for sharing. I know a lot of people, when they're looking for new positions, they want to know what the culture is like. They want to know what the team atmosphere is like. So it's always great to hear, firsthand, the different things that you guys are doing for that. Nancy, I'm going to kind of push it over to you now. I keep seeing multiple questions being asked. So you had mentioned you have the AAU float and you have ICU float. So for those positions, are those guys ever able to interchange where AAU float goes to ICU float or vice versa? Is there training for someone that's an AAU float that wants to go to ICU float? How does that kind of work? Or is it two separate float divisions essentially?
So the AAU and the ICU are two separate entities. However, it is very possible to cross-train. And what I mean by that is we do have a critical care training program whereby we we go through a selection process, and anyone that is interested in training from the AAU to float to the ICU is welcome to apply. And we have had a lot of success. We also do have opportunities where ICU nurses who are agreeable in the event we have a need in the AAU have been able to cross over and work on and care for acuity adaptable unit patients. So again, very separate entities, but there is opportunity for growth for AAU nurses to train for the critical care training program.
Awesome. Thank you. And then I know we're talking about nursing, but since we've had a couple questions, Nancy, are you looking for nursing assistants as well within Float Pool?
Absolutely. We do have a team of nursing assistants. So the Float Pool is comprised of nurses, nursing assistants, unit secretaries, and what we call the safety observation specialists. So we do hire nursing assistants. We actually have been able to see some of them progress from nursing assistants throughout their nursing program to join the nursing profession. So yes, we do.
Well, I'm going to give you guys a little bit of a breather and move it over to Jennifer. Jennifer, we're getting a lot of questions about, when I apply, is it just scanned by a system and automatically rejected? Is someone actually looking at my resume and my application? If I have additional questions, who should I ask? Is there a shift differential for night shift? All those things that people want to know before they apply for a job. So if you could kind of share, some of these answers, that would be beneficial to those looking to join us.
Yeah, thank you so much, Carly. So yes, I am the one that will receive the application and look at your resume. I'm always happy to answer any questions. If you receive an automated response or, have additional questions regarding the response that you received, I usually will email the candidates, but you guys are more than welcome to email me, message me on LinkedIn. I'm a very hands-on recruiter, so I will always be available to answer any questions. But yeah, so when you apply, I look at your resume. I will be the one to kind of look at, your resume, make sure you have the qualifications that we're looking for Float Pool. or even if we, you're not a fit for float pool, we will always share it with other recruiters, and just kind of say, hey, this candidate looks good for another unit within Stanford. And then once your resume is reviewed by myself, then we pass it on to our leadership team in the float pool, such as Jason, Nancy, and our other great APCMs that we have. And they will ultimately be the ones to decide, this candidate looks great, we're going to give them a call and pre-screen them, and then they'll be the ones to schedule that interview. In terms of shift differentials, we do offer an 18% differential for nights and a 5% differential for weekends. And then some great benefit for night shift nurses is that the parking is free. So I always like to mention that because I know parking can be a little bit of a struggle sometimes. So parking is free for our night shift nurses. We do offer a very high compensation package, great benefits, which I would be happy to share with candidates, if they want to send me a message directly on LinkedIn. And then we have really good, like I said, benefit package. We have, again, just a ton of really good benefits for candidates. If you're looking to relocate, we do also offer we could also offer relocation assistance. And it's a kind of on a case by case situation, but we do offer relocation. And we have what not a lot of companies offer, a relocation assistance resources. So Stanford just partner with some apartments in the area or homes that do offer discounted prices for our Stanford employees. And then we work with a company that also helps those first-time home buyers that are looking to maybe purchase a home with a down payment assistance program. So if you're looking to relocate and just haven't taken the plunge yet, Stanford has really great resources. As your recruiter, I will help you all the way through in getting some of those resources. So not just monetarily, but also helping you through that transition, because we understand making a change can be a little bit scary sometimes. In terms of health insurance, we do offer the company does have a plan where we pay for it, so you wouldn't pay anything out of pocket. But then we do also offer 2 other benefit programs. So hopefully that answers some of your questions.
You did good, Jen. I saw someone say a great selling point is free parking. That is always huge. That's one of the biggest perks for the night shift, as well as that 18% shift differential for all of our night nursing roles. That's huge. And someone asked for a bachelor's degree or being enrolled in a BSN program is also acceptable. Obviously, we know some people don't quite have that completed, so you're welcome to apply. Nancy, kind of circling back here, what's your ideal candidate look like? What does the experience and the education look like for someone for you to hire into float pool?
So what we're looking for in the float pool is someone that's flexible, because like I said, you would be going to up to 33 different units for AAU or 6 different units for ICU. So we're looking for someone that's eager to learn and grow, someone that is definitely compassionate and caring, someone that is able to speak up. Don't be shy, because again, you will be going to these units and caring for patients, and we're looking up to you to be able to identify challenges and be able to raise them without feeling scared. So we're always here to support you. So flexibility, adaptability. The one thing that's unique to the float pool is change is constant. That means on every given day, you do call the staffing office and they assign you to a home. So having that urge to be able to go to a different unit and care for any kind of patient, that would be great. We also are looking for, if you have that step down experience, that's an added plus for you, because we all our units have that telemetry aspect. And if you don't have it, don't be discouraged. Just take classes, take your EKG exam, and get your experience from another organization and apply. We also, the beauty of float pool is, as we screen our patients, we can also identify someone that is a good fit for a home unit. So let's say you have that skill set that is suitable for a home unit, but not quite there yet for the float pool. We work very closely with Jennifer, where we are able to route you to a home unit where you will be a good fit as you build on your skill set.
Thank you, Nancy. And Jason, when people are coming into float pool, are they floating to multiple units during a shift, or do they stick to one or two per shift?
So that was a great question. It will vary depending on the needs that day. So for day shift, we have staffing intervals at every 4 hours. So usually at about, the first one will be at 6:45 is usually our first start time, then 10:45, then 2:45, and then the night shift comes back on at 6:45. So day shift, there is a little bit more of perhaps a little bit more of an opportunity to float if there are needs every 4 hours. Night shift just has the initial staffing interval, which is you would call for at about 6:45 p.m. And then they have another one at 22:45 p.m. So potentially you could float up to twice on nights. And again, it just kind of varies depending on what the needs of the organization are looking at as far as staffing intervals go. But I think our staff really enjoy that. They enjoy having the variety of experiences. They enjoy being able to kind of see, patients in all sort of different specialties. And also it makes them able to kind of practice skills that they maybe wouldn't necessarily have the opportunity to practice if they were on a home unit, because they are exposed to a lot more when they float throughout the house.
Awesome. And then one quick question to tie that up, Jason. They're just floating at the main campus there at 500p, correct? Or are they floating over to 300p? Like that, no one ever leaves the main campus for float pool, correct?
Yes. So at our organization, we have 300p and 500. So put together 800p, 800 passenger. But that is essentially our Palo Alto campus. So our float pool stays within the inpatient Palo Alto campus. So just the main hospital itself. That's a great question.
I know our campus itself is so large. So I know, a lot of people probably look at, we've got, Redwood City and San Jose. So they start thinking, oh my gosh, I'm going to get sent everywhere. So we only have a couple minutes left, but I wanted, before we wrap up this time with Jason and Nancy, I really wanted to have them just, I guess, answer a kind of a simple question. You've been here for so long. You chose Stanford. You love Stanford. Why have you stayed at Stanford? And what would you tell someone that's looking to make the jump to Stanford? Why have you stayed? Why do you think it would be great for them to hop over? And Nancy, I'll start with you.
This is one question I always enjoy because, again, I have been at Stanford for 9 years. I love Stanford because of the culture. There's a culture of cohesiveness, community. Our leaders care for us. We have what we call CI care, which is the way we communicate with each other. There's respect, there's mutual understanding. We all work towards a common goal, which is caring for our patients with highly skilled and versatile staff who provide support, and there's lots of opportunities for growth. One thing I like to share is I commute an hour away every day, and that's because I love Stanford, and that in itself tells a lot. And so my goal is to present the same opportunity for my staff to be able to come to work every day, have a great day at work, whether it's the way they interact with each other or the kind of support they get from leadership. That's always my goal. My goal every day is for everyone to be happy to come to work. So that's it for me.
All right, Jason, you're up. What makes Stanford so special to you?
Yeah, thank you for that question. I as a transplant to California and the Bay Area, I kind of moved down here without really knowing anyone. And so to be able to kind of build a community within Stanford that has fostered a lot of personal and professional growth, I think has been what's kept me at Stanford. There's unlimited amount of resources in the way that you want to maybe progress your career, but also just to network and kind of see like sort of the cutting edge world-class care that we provide here at Stanford Healthcare. I was fortunate enough to get my graduate degree here with the assistance of Stanford, and it's been a wonderful experience, to be able to transition from the bedside to charge nurse to being in shared leadership, and then now to being an assistant manager. So I really love the culture of just being able to challenge myself and feel supported, but also really foster those connections that make me sort of want to be the best version of myself as far as a registered nurse.
Awesome. Well, Jen, of course, I'm going to ask you, you've been here a year, you made the leap from another local hospital system. What made you make the jump to Stanford, and, why you love working here? And then maybe wrap it up, since a lot of these guys are looking at applying. What's the best way to reach out to you to ask questions, learn more about opportunities, maybe even have help with their resume, making sure that, they list what you're looking for?
Yeah, thanks, Carly. So, what I love about Stanford is just being able to work with so many professional and diverse leadership. And the candidates that we get here are just amazing. The stories that I've heard as a recruiter, I love to interview my nurses and just hear, their experience, where they came from. I love when I make an offer to a candidate and they say Stanford was a dream and I've made it. And so for me, it just makes my job so sweet. As far as how to get a hold of me, you can either reach me through LinkedIn. You can send me an email. So what I'll do is I'll leave a comment with my email address when this chat closes. And then, again, just apply. In terms of what we're looking for in a resume, it's very important that you do always upload a resume when you are applying to any position with Stanford. Even if you have already applied to other roles, always upload a resume, because it just makes it easier for us to review your information and make sure that you are going to be a fit for any unit. As recruiters, again, we work together in partnership, and so we're always looking out for each other. So even if you are not a fit for Float Pool, we will, again, share your resume with other recruiters. So it's important that we have an updated resume with dates of employment and, specific units that you worked for. So if you were in a step down unit, be sure to list that there. If you worked for a cardiac unit, ICU, whatever you worked for, please add it on your resume so that it makes it easier. At times, we will message you and say, hey, could you please upload a resume? But sometimes we just get so many that, we just don't have the time to send you a note. And so please be sure, again, to upload that resume so that it makes it easier for us.
Awesome. Thanks so much, Jen. Well, I just want to say a huge thank you to Jason and Nancy. I know it's super hard to take a step away from your nursing and management duties over there in Float Pool, but I appreciate you guys coming and chatting with us today, kind of educating, I think, a lot of people on what exactly Float Pool is. But this has been a lot of fun, and thank you everyone that joined us. Hopefully we got most of your questions answered. If not, again, feel free to reach out to Jennifer on LinkedIn. We'll put her email down there. I also know that we've had a couple people putting the links specifically for Float Pool positions for nursing assistant and for clinical nurse too. So be sure to click on those, apply, and then Jennifer will review and send you over to Jason and Nancy. So have a great Thursday, and we will see you guys on our next event.